Now for our last topic, which is the prevention and management of COVID-19, may we call on again Ms. Meg Bukuhan to introduce our next speaker.
Good afternoon, everyone. So actually, our next speaker for today is actually one of my former professors from my undergraduate studies. So she was born and bred right here in Pamantasan ng Lungsod ng Maynila, finishing as magna cum laude for BS Biology in 2000, and finishing her medical studies at our own College of Medicine, ranking 6th in her class. She finished her master's degree in public health at the College of Public Health, UP Manila in 2018. She completed her clinical fellowship training in the Division of Infectious Disease at the Department of Medicine in Philippine General Hospital and is currently a clinical associate professor there. She's also a fellow and diplomat in the Philippine College of Physicians and Philippine Society for Microbiology and Diseases, and is currently the president of the Philippine Hospital Infection Control Society, Incorporated. Lastly, she's an associate professor at the Department of Medical Microbiology at the College of Public Health, UP Manila, where I was her student. Everyone, I am truly honored to introduce Dr. Evelyn A. Rojas. Let's all give her a warm welcome.
So thank you very much, Meg, for that kind introduction. And I would like to thank the Supreme Student Council of the Pamantasan ng Lungsod ng Maynila for inviting me and sharing with the two other speakers this talk about COVID-19. So I would like to congratulate the first two speakers who gave a very comprehensive lecture on their respective topics. So I'm assigned to discuss about prevention and control and management of COVID-19. So here are my objectives. So I'll be discussing the preventive measures against contracting COVID-19 for individuals, not only in the hospital, but at home, work, and on community, to clarify the indication of different available masks for use. Okay, so isang common issue kasi to with what specific mask should be worn in the community. And to discuss briefly the current management of COVID-19, I will not be discussing too much on the management, but I'll be giving an overview. How do we manage COVID-19 patients? And mainly to, as given by our MC a while ago as an intro. So you said you were overwhelmed with a lot of information about COVID-19. It's our 6th month, going to the 6th month of the pandemic already, and we are all overwhelmed with the different facts and informations about COVID-19. So we'll try to segregate which are true, which are the facts, and which are fake news. Ayaw natin ng fake news, di ba? Even with COVID-19. So just to give a brief background, so Dr. Carlos, so Carlos is my student, my former student at CPH, gave a very good lecture about epidemiology, but I'll just give a brief background that it was in February 11, 2020, when WHO, or the World Health Organization, declared that COVID-19, or the coronavirus disease 19, is a novel disease. So novel meaning new, it was not present, so it was not identified before, so it was a novel disease, and it was in February 11, 2020, when it was declared by WHO. During that time, it was also declared that the novel disease is caused by a novel virus, so a new virus also, namely the SARS-CoV-2, or your severe acute respiratory syndrome coronavirus 2. So 1 month after, WHO declared already that COVID-19 was a pandemic because of its global distribution, di ba? By definition, pandemic is when a disease has a worldwide distribution, so it will be classified as a pandemic already. So COVID-19 is a pandemic, is considered as a pandemic, and we are living in a pandemic time, okay, di ba? Who would imagine that during our time, 21st century, we have a pandemic, we're living in a pandemic, okay? So just a background on the cases. This was discussed by Carlo, but this was as of Tuesday. We have 23 million cases. You know, almost every week I give webinar about COVID-19 and I always update the epidemiology or the cases. So every week, dumadami talaga. So I think first week of August, our census cases worldwide is around 16 million. But now, during the last week of August, we have 23 million cases already. So locally in our country, this is as of yesterday, we have a total of 209,000 cases, diba? We've reached that more than 200,000 cases na. And this was discussed by Sir Carlo a while ago. We have consistently 3,000 to 4,000 new cases reported every day. That's why we've reached to this 200,000 mark of active cases in the country. Anyway, although masyado dwell sa numbers, diba? Minsan when you look at these cases, you really feel depressed or sometimes sad. But eventually, diba? Wala namang forever. Eventually, we'll end this pandemic. We'll reach that end. Okay, so just a background on the etiologic case of the disease. As I've mentioned, it is caused by a virus, namely your SARS-CoV-2. So I flashed this slide because I just want to show everyone that SARS-CoV-2 is a close relative of your SARS-CoV, your severe acute respiratory syndrome coronavirus. Naabutan niyo pa ba yan, Meg? Siguro, baby pa kayo, no? 2003. It was a novel virus also during that time because it was not discovered before. So it caused severe acute respiratory syndrome disease identified in China. It's also a close relative of your MERS-CoV, your Middle East Respiratory Syndrome coronavirus, which was then identified in 2012. It originated in Saudi's Middle East, but very short. Okay, so very brief course only or cases only with MERS-CoV until we have this in 2020. So first it was named as nCoV 2019 or your novel coronavirus 2019. But as I've said, it was eventually renamed in February 11 as severe acute respiratory syndrome coronavirus 2 because of its close relationship or close relationship with your SARS-CoV. So my main task is to discuss the prevention and control, but I always start my lecture regarding prevention and control with the mode of transmission of the virus, because the only way that we can properly prevent getting COVID is when we know how is it transmitted. Okay, so yun ang tatandaan nating lahat. For us not to be that praning, diba? Or not to be that lax, we have to know how is it really transmitted so that our mode of prevention will also be effective. Okay, so to date, the main mode of transmission of SARS-CoV-2 is via human to human. So meaning when you have an infected person that sneeze or cough in front of you, okay, you produce respiratory droplets. So this is a slide showing respiratory droplets, okay? And when you inhale it, okay, so that's the main mode of transmission of getting the virus, then you can acquire SARS-CoV-2. So respiratory droplets are particles produced when you inhale, when you exhale, sneeze or cough. It consists of respiratory fluids plus the virus. So respiratory droplets are large enough, so around more than 5 to 10 micrometers in diameter. So what's the implication of this? I always tell everyone the size of the respiratory droplet because it's very important that we know that it is large enough. So meaning pag malaki, so malaki yung droplets, it cannot reach far beyond 6 to 12 feet. So it has the tendency to fall on the ground because of gravity. Okay, so beyond 6 feet or 12 feet, your respiratory droplet should somehow be not be transmitted to you. This is also the rationale why we always advise maintaining physical distance, diba? Minimum of 6 feet. Because somehow if we will stick with the main mode of transmission of the virus as respiratory droplet, if you're far enough, dapat hindi makakarating sa iyo yung virus. Okay, so WHO states that so far, again, the main mode of transmission is via respiratory droplet, and airborne can only be it can be transmitted via airborne whenever you perform AGP or your aerosol generating procedures. In the hospital, whenever we do CPR or cardiopulmonary resuscitation, when we intubate patient and even extubate, okay, those are aerosol generating procedures. And these procedures can transform these large respiratory droplets into smaller aerosol. Thus, an airborne mode of transmission can be possible. Okay, so this is the difference between respiratory droplet and a droplet nuclei. It is when you have airborne transmission, you have droplet nuclei. So you see you have less than 5 micrometers. So it has the tendency to reach farther than 6 to 12 feet. Unlike when you have respiratory droplets, malalaki yan. So after 12 feet, usually it cannot reach beyond 12 feet. Okay. So, but there was a time where airborne transmission was a big issue for COVID-19. So there were several studies which look onto this, the possibility of airborne transmission of SARS-CoV-2. And it showed again after an event, for example, of sneezing. So when you have a large droplet, when we stick that the SARS-CoV-2 is a respiratory droplet, you see the farthest that it can reach is around 6 meters. Okay, so that's 12 feet. But the aerosols can reach farther than that. Okay, after coughing, so sneezing is more forceful than coughing. So coughing may be around up to 3 meters. But when you have, after exhaling, okay, so the farthest, so this is the usual conversation. So when we usually converse to a possibly infected person, the farthest that it can reach is up to 1 meter only. Okay, but then again, the aerosols can be produced or can reach farther than that. So this figure shows that when you have an infected person here, which do not wear any mask or any respirator, you have all of these large droplets whenever he or she speaks or coughs or sneezes. But when he or she wears a surgical mask, for example, there is a decrease, somehow a decrease in the production of respiratory droplet, and all the more when we wear N95. Okay, so N95 can really reduce the droplets, respiratory droplets, and the aerosols produced. So this figure naman shows that when you have, again, an infected person here and then a susceptible host, okay, which is close enough, so less than 1 meter, you have all the risk of getting the virus. But even when the infected person is not wearing a mask, but the susceptible host is somehow wearing a mask, so he or she becomes protected. Okay, so nababawasan yung risk of getting the respiratory droplets. And again, all the more when you wear N95. So this study concluded that still the main mode of transmission of SARS-CoV-2 is via respiratory droplets. I've discussed a while ago what is a respiratory droplet, but airborne transmission is possible, okay, from non-violent and even violent expirations of SARS-CoV-2. However, experimental studies are still really needed to confirm that airborne is the main mode of transmission of SARS-CoV-2. Okay, so aside from human-to-human transmission, the other way of transmitting or spreading the virus is via contact infection. So this is an established mode of transmission of the virus also. So this figure shows that you have here an infected person who after sneezing or coughing, and he did not perform cough etiquette. So we all know what cough etiquette is. You don't cover your mouth. Okay, so you produce the respiratory droplets already. It has the tendency to fall on surfaces. Okay, so surfaces can be contaminated. So that's why we have fomites or inanimate objects, okay, that can facilitate the transmission of the virus. So how? So itong common misconception eh. So when you have, for example, yung table, yung pera nyo, or plastic, Okay, hindi naman yun automatic na contaminated. Or it can be contaminated but it's not automatic that you can get it. So paano lang yun makaka-enter sa body nyo? Paano lang? It is via through your hands. So when you touch these contaminated surfaces and you don't perform hand hygiene and then you eventually touch your the portals of entry of the virus going to your body are you have your mouth, nose, and eyes. Okay, so when you have contaminated hands and then you touch your mouth, your nose, and then your eyes, that's the only time that the virus can enter your body. Okay, so it's not yung, minsan kasi napipiloso po eh, you have yung table or your chairs or yung minsan sa hospital, yung charts. Okay, so hindi naman makapasok sa body if without the help ng hands. That's why we always advocate hand hygiene. Okay? Sige. So several studies show that the virus can remain on inanimate surfaces after 24 hours on cardboard, after 2 days on steel, and after 3 days on plastic. Okay? So some studies showed nga that it depends on the inoculum, okay, or the amount of the virus on the surface. It's not automatic naman that you have this, for example, hindi naman, imposible naman ang isang virus. But this slide showed that there should be sufficient enough of the virus for it to contaminate the surface. Okay, so the conclusion of the study is that, again, SARS-CoV-2 can remain viable on inanimate objects, but it will depend on the amount of inoculum and some other environmental conditions like temperature and humidity. So this slide summarizes, ito marami nagtatanong eh, so gaano ba katagal pwede mag-survive si virus? So ayan, if you have wooden table, around 4 to 5 days, sa plastic daw, 4 days, okay, and sa copper, you have more than 4 hours. But then again, yun nga, parati kong sinasabi, even if you have all of these information, how long can the virus survive on inanimate objects, but when you disinfect this and you wash your hands, there should be no problem. Okay, so hindi dapat yan issue. Okay, how about other modes of transmission? Can the virus be transmitted via stool? So this is an uncertain mode of transmission for the virus, and all the more the blood. Okay, so remember, SARS-CoV-2 is a respiratory virus, and wala pang respiratory virus that is transmitted bloodborne. Okay, so far wala. Okay, so with all of these, the WHO still recognize that the main mode of transmission is via droplets and via fomites. Thus, they recommend droplet and contact precaution and only observe airborne precaution when you perform aerosol generating procedures. Okay, so I just want to show here that an infected person, I think nabanggit mo to kanina, is most infectious during the time of onset symptoms. During the first part of illness, when the patient is symptomatic, okay? Because through time, as the patient becomes asymptomatic, his or her degree of infectivity decreases also. So later on, I'll be discussing that because it has an implication in the protocol for isolation. Okay, so management, my management, I'll just be flashing here how do we manage COVID patients. So I'm a practicing infectious disease specialist, and we see a lot of COVID patients, particularly in the hospital, hospitalized COVID patients. And our management is mainly dependent on the classification of the patient, okay, of the COVID patient. So I think this was mentioned by the first two speakers already. So it's very important that we classify whether they are asymptomatic or suspect or confirmed. Management will also depend on that. So what do I mean by this? For example, if the patient is asymptomatic, so quite stable, then hospital admission is not necessary. Okay, so we have here this is the PSMID, Philippine Society for Microbiology and Infectious Diseases algorithm or management guide. So again, We classify them whether they are mild, moderate, severe, or critical. And again, the management will depend on their classification. Of course, those with critical, those are the intubated patients should be admitted in the ICU and has corresponding management, while those with moderate only can be admitted in the floors or in the usual ward. And again, pag asymptomatic, pwede ang home quarantine. Okay, so just monitor only. Okay, so I think I included this because this is part of the management, yung isolation protocol na sinasabi namin. So this is one of the commonly asked questions. What if you're living with a suspect, probable, or confirmed COVID-19 case? So anong pinakamagandang gawin? Okay, so ang best advice that we always say is to seek medical consultation. Okay? Madali na lang naman ngayon mag-consult not necessarily sa hospital. We have telemedicine already, it's available. But that's the first thing that you should do. Whenever you have a household is considered probable COVID-19, then you seek medical consultation because only physicians or doctors will give you the appropriate advice. Okay, so they might advise you to be admitted or your household or to just undergo home quarantine. Again, close contact of all symptomatic patients who are considered close contact should be tested using RT-PCR. So na-discuss na to ni Sir kanina. Okay, so RT-PCR is the gold standard for diagnosis of COVID-19. And speaking of close contact, so ito, yun nga, hindi naman lahat ng kasalamuhan nyo can be categorized as close contact. There's a strict definition for close contact also. And according to the guidelines, it's defined as a person with exposure within the 14 days of a probable or confirmed case, okay? And exposure is face-to-face within 1 meter, hindi nag-observe ng physical distancing for more than 15 minutes, okay? And direct physical contact with a probable or confirmed case and direct care of a probable or confirmed COVID-19 disease without, okay? So itong mahalaga, without proper PPE. Kasi kami, like for the frontliners or healthcare workers, so every day, look after a COVID-confirmed patient. So can we be considered as contact before ever na kaming close contact? So hindi ganon. So if we wear our proper PPE, then there should be no issue even if we are taking care of a confirmed COVID-19 case. Okay, so in the hospital, in the workplace naman, so it's issue din kasi, aside from home, sa workplace, kung meron ding suspect, probable, or confirmed COVID-19 case, anong dapat gawin? So simple rin lang. So do not panic. I think narinig ko to kanina kay Sir. So isolate is very important. And then refer again to a physician who will give the final decision whether you will be advised to be admitted or just do home quarantine. Okay, so again, if you're a close contact and you become symptomatic, so you develop symptom, then it's requested that you undergo RT-PCR. So I think Sir discussed a while ago when is the best time to perform RT-PCR after a possible contact. Okay. So this is a very controversial. Hindi naman ganun ka-controversial, but this is an updated recommendation already for discontinuing patients from isolation and rejoining the community. You know, for us na hindi patients, it's very easy that we say that you isolate for 14 days. But we have to understand what's the impact of this to the patient. Imagine, sabihan nyo sila na mag-isolate sila ng 14 to 21 days. Okay? So before, during the first 2 months of the pandemic, ganon lang kabilis magsabi. But now, nag-i-evolve ang information about COVID-19. And this is the latest recommendation now. So for isolation, the recommendation is time-based or what we call a symptom-based. Okay, so whenever we admit severe or critical COVID-19 patients, we isolate them for 3 weeks, so 21 days after the first symptom onset, plus at least 3 days na wala na silang sintomas. Okay, so that's the time that we can discharge the patient, or we can say that they can go back, okay, to their community, or they can we can lift the isolation precaution already. I think narinig ko to kay Sir kanina. So before, the recommendation is 2 RT-PCR negative before we can consider the patient as recovered. But now, again, I want to emphasize here that we follow the symptom base already. So if you fulfill, for example, for this severe or critical, 21 days, finish na mag-isolate siya, and then asymptomatic, actually it's not needed for them to have a repeat RT-PCR swab. Oo. Ito medyo mahirap matanggap, but we are fully advocating it now. Okay? Kasi we don't rely now on tests for us to say that they are recovered. So we are more of symptom-based and time-based. Actually, in the hospital, we discharge patient even without a negative RT-PCR result, and we can even advise them that they can go back to the community or leave the isolation as long as they fulfill this criteria. Basta asymptomatic na sila. Okay, and then 14 days, for example, sa mild to moderate, 14 days ang nakalipas since their first symptom onset. Okay, so I hope this is clear. Oo, so medyo nahirapan pa kaming baguhin ang thinking ng community now, but we highly advocate this already. So we don't need a repeat RT-PCR negative test before we lift the isolation precaution or the isolation of the patient. Okay? So basta asymptomatic na siya. O how about kung to start with asymptomatic si patient? So ilang days naman ang iintayin? So 2 weeks pa rin. So after 2 weeks from the first day na lumabas, or hindi lumabas, from the time na kinuha yung swab test. So you have to wait for 14 days before you can say that the patient is recovered already from that particular COVID-19 event. Okay? So I hope this is clear. So again, we don't repeat. It's not necessary that you repeat the RT-PCR anymore for you to say that the patient is recovered. So this is the latest guideline from the Department of Health and even from our medical societies. Okay, so speaking of prevention and control, so I think this was shown by Carlo a while ago. So 3 high-risk areas for COVID-19. So closed spaces with insufficient ventilation, crowded conditions, and then conversing in short distance. So it's very important that you know these high-risk areas, because somehow if you know this, then you can prevent, diba? Your prevention and control measure will be more effective. Okay? So in general, IPC has these strategies. So we have the standard precaution, specific infection control precaution, and then administrative, environmental, and engineering controls. Okay, so we have a hierarchy of controls in IPC. So this is not only applicable for COVID-19, but even in other diseases or in other control measures. On the top of the hierarchy actually is the elimination. However, with COVID-19, parang medyo difficult, no? Pero ang medyo ine-equate na nila with elimination is the social isolation or the physical distancing. That's why this is the rationale why our government implemented that enhanced community quarantine during the first part of the pandemic. Okay, so because it's the highest, it's on the top of the hierarchy. Of course, when you do not have the virus, you do not have the contact, then that's the best way to prevent getting the virus. And as you can see here, we have these engineering controls and then administrative controls. Later on, I'll be discussing that. And on the bottom, Actually, sa baba ng hierarchy of control is the PPE. Okay, but this is the most feasible kasi. It's the most commonly used approach in preventing and controlling COVID-19. But actually, it's at the bottom of the hierarchy. Okay, so speaking of engineering controls, so engineering controls basically pertain to the physical barriers, diba? Curtains between patients in the hospital, and also the proper ventilation. So these are all the engineering controls when we say engineering control in preventing COVID-19. As opposed to your administrative controls. Administrative controls are the policies, okay? For example, in the hospital or in the school, when there are infection control policies, so that pertains to administrative control of for COVID-19. So good example for this is, for example, sa hospital, di ba, merong 1 week na duty si nurse, and then after 1 week, you have off days. Okay, so nalalagay yan sa IPC policies, infection control policies, so that malesen din yung contact ng healthcare workers, the risk of getting the virus by lessening the contact to patients. Okay, so that's administrative controls. Okay, so other infection control measures, screening form. Diba, hindi lang sa hospital, even sa mga restaurants, I see a lot of, diba, bago tayo makapasok sa mall, sa hospital, we have to fill up this health declaration form or even a screening form. And I believe that this is an important method also talaga in controlling COVID-19 because somehow, strict so na parang stricter way of allowing people to go inside your building. Okay, with that, you have lesser risk also of communicating or being with a possible COVID-19 patient. So this is just an example of screening form. Okay, so diba kapag inuubo ka lang or may lagnat ka, so medyo kailangang i-further work up ka to ensure that you are not a COVID-19 patient. Yun ang sinasabi nila mahirap ubuhin ngayon kasi parang somehow, you have to prove them that you are not COVID-19. Okay? So, yan. These are all engineering controls. Part of decreasing the risk of getting COVID-19 also is the implementation of telemedicine. So, we see a remarkable decline in the number of outpatient clinics consult. Kasi nga, yung pa rin, effect of the pandemic. So limit face-to-face contact. That's why telemedicine is highly encouraged during these times, during this pandemic. Because, of course, there are instances where inpatients can really consult naman via, for example, laptop or through your phone without face-to-face. Okay? And with that, you again lessen the risk of contact of getting the virus by lessening the contact to a probable COVID-19 patient. Okay? So another infection control measure is use of masks, diba? Hindi lang sa hospital, but in establishments, there is no mask, no entry policy. Okay? Kasi before, hindi nila nire-recommend ang universal masking, but now they recommend use of mask all the time, whether you're in the hospital or in the community. But we want to inform everyone that it's not just wearing the mask. There should be proper use of medical masks. Sabi nga nila, Philippines is one of the countries with the highest rate wherein we follow wearing masks. Diba? But how come we still have a lot of cases? Kasi yung iba nag-wear lang ng mask pero hindi proper. Okay, so this WHO infographic showed the proper way of wearing mask. Hindi, ito muna improper way. So you don't put it under your chin, you don't put it below your nose, and all the more, hindi nyo ginagawang headband. Okay, so the proper way of wearing mask is that it should cover, so this is an N95 and this is a surgical mask. So a mask should cover both your nose and your mouth. Diba? Kasi those are the portals of entry of the virus. Okay? And for your N95, ganun din. And it should be below the chin. Okay? Somehow to support your mask. So beyond this, that's improper use of mask. So ito lang ang proper way of wearing mask. Again, it's very important to emphasize that you just don't wear mask, pero tama yung paggamit nyo ng mask. Okay? So other infection control measure, maintaining social distancing. So studies, this is scientific or evidence-based. It showed that maintaining physical distancing can decrease the chance of getting the infection. Okay, so from 12.8%, it can decrease to 2.6%, particularly if you maintain physical distance of more than 1 meter. Okay, so this is a Lancet study already, which concluded that this minimum public health measure, meron na nga tayong tinatawag na minimum public health measure, why we still don't have the drugs and the vaccine, we have to follow this minimum public health measure to prevent getting the virus. So maintaining physical distancing, use of face mask, and eye protection. Isang issue din yung eye protection. So eye protection pertains to your goggles or your face shield, okay, as an additional PPE even in the community. Okay, so si mask kasi covers your nose and your mouth eh. So naiiwan si eyes, and I've said a while ago that eyes can be a portal of entry of the virus also. So that is the purpose of the face shield na minamandate na nila na gamitin natin. So face shield can really help prevent in the transmission or in getting the virus. Okay? So other measures, hand hygiene. So we cannot overemphasize the performance of hand hygiene. Hand hygiene pertains to whether you do hand washing with soap and water or your alcohol-based hand rub, di ba? Ngayon, kapag umalis ka ng bahay, you go to your office or sa mga mall, you should bring with you an alcohol-based hand rub all the time. Okay? Kasi before, nagiging excuse nila yan eh. Pag walang faucet, hindi makapag-hand wash daw. But an alcohol-based hand rub should give the chance for you, okay, to perform hand hygiene all the time. Okay? I've emphasized a while ago the importance of hand hygiene. So, hindi makakapasok ang virus sa katawan natin kung malinis ang kamay natin all the time. That's why it's very important to perform hand hygiene. So, how about wearing gloves? Okay, will it protect you? Okay, so wearing gloves, kung gusto nyo gumamit ng gloves, okay naman. But it should still be coupled with washing your hands. Because after you remove your gloves, you still have to perform your hand hygiene. Okay, so ito dapat ang maalala natin. So other control measures, you have to perform respiratory hygiene. I've mentioned this a while ago. You have to cover your mouth, okay, and your nose whenever you cough or you sneeze. Okay, so you can just imagine your contribution of lessening the transmission of the respiratory droplet when you cover your mouth every time you sneeze or you cough. And then you cover it with your bare hands or with tissue. So si tissue dapat itatapon sa trash can, and then afterwards you perform hand hygiene. Hindi lang yung cover your mouth tapos okay na. Parating kasama si hand hygiene. Paulit-ulit na parang silang plaka with hand hygiene, but it's very important. So hindi kami mapapagod mag-advocate ng hand hygiene or hand washing. Okay? So other control measures, so PPE, this might not be very applicable in the community setting. This will be applicable in the hospital. But I just want to mention here that in the hospital, we wear appropriate PPE. And appropriate PPE means that your PPE should be dependent on what area you are assigned. So for example, nasa low-risk area na kayo, for example, sa outpatient clinic that's considered as a low-risk area, this is the minimum PPE only. However, when you are actually taking care of COVID-19 patient, then you have higher level of PPE. So that's a complete PPE already. Okay? Sige. Ayan, may cameo si Dr. Roman, batchmate ko. So in the outpatient clinic, for example, si doctor should wear only a face mask and an face shield or a goggles. So that's the minimum PPE. Kasi we want to tell the public also that sa infection control kasi yung too much is not appropriate PPE eh. So dapat yung sapat lang, yung tama lang, what is the recommended. Too less and too much are not appropriate. So dapat sakto lang ang PPE natin. So it depends on your area nga where you are assigned. So that's appropriate PPE. Besides, we don't really advocate yung overuse of PPE, yung OA na PPE, because we have the issue of shortage of PPE already, particularly your N95. Okay, so we don't know until when this pandemic will be. Kaya as much as possible, kung masisave natin, save natin mga PPEs na to, particularly your N95. Besides, yung issue sa environment, ayaw din nating mag-contribute sa waste if we only dispose this N95. Before, ideal, nung hindi pandemic, that's the recommendation. Pero since we are in a pandemic, we try to go or adjust ourselves to crisis setting. So pwedeng mag-reuse or mag-extended use ng mga PPEs, particularly your N95. Okay, so may shortage na tayo ng N95. So dapat in the community, hindi yun na-abuse. Okay, so you can use alternative mask. I think kasama to sa objective ko aside from N95. How about KN95? We recommend the use of KN95, particularly if nasa community lang naman or you're not doing aerosol generating procedures. Pwede naman ang KN95. Okay? So these are the other control measures. Engineering controls, so maintaining physical distancing. In the hospital, you can see this. Okay, how about foot bath? Sa hospital, nakikita natin to, hindi lang sa hospital, sa mga establishments also, we see a lot of foot and shoe bath. We tried to look for scientific evidence for this, but so far, there is an insufficient evidence. Pero kung naandyan na, okay din lang naman. That's why we have this recommendation. So it can be, there is no sufficient evidence to recommend the use of foot or shoe baths. However, whenever we use this, we should follow the manufacturer's instructions, and then we should know the frequency of replacement to ensure the effectiveness of the disinfectant. Okay, so another issue for infection control for COVID-19, proper ventilation. Okay, so there should be, wala ako. So there should be proper ventilation. Ventilation is ano lang naman eh. There should be good air exchanges circulating in a room, okay, to prevent or to lessen the risk of getting the virus. So yan lang yan. How about HEPA filter? I'm sure you hear a lot of HEPA filters na ano, di ba, binibenta sa Lazada. Marami yan. So high efficiency particulate air filters, so they can help in filtering the air, but not necessarily increasing the ventilation. Okay, so our recommendation for HEPA filters is that it provides additional benefit in improving the air quality, but not necessarily the ventilation. And whenever we install HEPA filter, we should follow the manufacturer's recommendations. Okay, so other engineering control, yan, mga acrylic barriers. So okay lang naman si acrylic barriers. But the issue with acrylic barrier is that it should be properly cleaned and disinfected. Diba? Itong mga plastic barriers na to. And speaking of disinfection, so cleaning and disinfection during the time of COVID is very important. Okay, so WHO and even the Department of Health recommend proper disinfection of environment as an important infection prevention and control measure against COVID-19. So COVID-19, although this is a novel virus, it's a virus that can cause mortality and morbidity, can easily be disinfected or can easily be prevented when we clean our environment. Okay? So wag nating mamaliitin tong infection prevention and control measures na to because it can have a big translation. Okay? Imagine if you just ensure that you clean and you disinfect the surfaces, then there should be no problem with the transmission of the virus. Okay? So we recommend the use of bleach. So ito yung household bleach that tanong nyo sa mga parents nyo, siguro kayo hindi kayo naglilinis sa bahay kasi tutok sa pag-aaral. But sa household or even sa hospitals, we use this sodium hypochlorite or this household bleach. And this bleach can easily kill SARS-CoV-2, okay, na nasa surfaces. So pag clean yung surfaces, tas malinis pa yung kamay nyo, then it cuts the chain of transmission of the virus. So there should be no problem with that. Okay, so we usually disinfect the commonly touched surfaces. Okay, so wooden table, door handles, okay, light switches, commonly touched kasi ito yung madalas mahawakan di ba? So at risk for probably getting the virus. So these commonly touched surfaces should also be regularly cleaned and disinfected as compared to the not so commonly touched surfaces like your ceilings and your window. Again nga, sabi ko nga sa infection control, pag dapat OA. Diba? Hindi naman kailangang linisin araw-araw yung ceiling. That will be too tedious or yung mga bintana. So ito lang, yung commonly touched surfaces lang ang nire-require nila for us to be clean and disinfected. Okay? So how about, I'm talking about the household bleach or Clorox. There were some myths regarding it. So spraying directly the household bleach will not prevent COVID-19. Actually, drinking, all the more drinking is not recommended by the Department of Health because it will be somehow toxic. Okay? So instead of, hindi ka nga magkaka-COVID-19 but you'll die from intoxication. And we all know that bleach is a toxic chemical. It can cause death. Okay, so all the more when you drink it. So we don't recommend spraying or misting of these disinfectants directly to the person. So ang recommendation is manual disinfection. So meaning you wipe the surfaces. Okay, so yun ang recommended na disinfection for COVID-19. Okay, so other modes of disinfection, how about the use of UV, ultraviolet? I'm sure maraming kayo naririnig sa mga UV sterilizers. So UV, okay, is considered as an adjunct mode of disinfection. However, we should always be reminded of the precautions whenever we use UV light. Okay, so it should not be used directly sa skin and eyes because it can cause keratitis, and your room should not undergo UV if nasa loob kayo. Okay, so you should take some time before you enter your room again whenever you disinfect your room with UV light. Okay, so UVGI or your ultraviolet germicidal irradiation is an adjunct or an addition to disinfection procedures. So yung mga UV sterilizers na portable, pwede naman as long as you follow the manufacturer's protocols and you observe the safety precautions. Okay? So waste management is also an important infection control measure. COVID-19, it's an infectious disease, so we follow the segregation of wastes. Okay, so as to prevent the further transmission of the virus. In the hospital, nilalabhan yung mga linen that is closely related with COVID-19, so it should not be sorted to prevent the further spread, and we follow this one. Okay, so some just myths and misconceptions about COVID-19. Okay, so again, hand dryers daw can kill the coronavirus. So we can prevent all of these myths or fake news if we know the mode of transmission of the virus, which I extensively described a while ago. So dryers cannot directly kill the virus, but it's the hand hygiene, okay, that can prevent the transmission of the virus. So taking antibacterial such as amoxicillin will prevent COVID-19. It's again a myth because remember COVID-19, SARS-CoV-2 is a virus and amoxicillin is an antibacterial. And so far, we haven't discovered, so wala pang na-discover na pre-exposure prophylaxis or even post-exposure prophylaxis against COVID-19. Maybe in the future, baka kayo, mapag-aralan nyo in the future, but there are ongoing studies about use of prophylaxis against COVID-19. But to date, wala pa. So, gargling, okay, with, ano ba yan? Mouthwash can prevent COVID-19. It cannot directly, okay, there's no scientific evidence that it can directly decrease the load of the virus. So, this is still a myth. And can it be transmitted by flies or mosquitoes? So again, to date, still the main mode of transmission is via human to human. There is no known vector yet, okay, for COVID-19. And I think respiratory viruses in general are not vector-borne diseases. So it cannot be transmitted by langaw or lamok. And COVID-19 is not a death sentence. All the more na ngayon, no, where a lot of information or the information is evolving. So somehow medical practitioners are becoming more adept in handling the cases of COVID-19 in the hospital. And our scientists are continuously researching, okay, to get a new news or information about COVID-19. So it should not be declared as a death sentence. So actually marami nang asymptomatic cases ngayon. But still, we have to be cautious about the disease. Okay? So garlic, bawang, it will not definitely prevent COVID-19. And all the more yung hot pepper, no? Kahit na gaano pa kainit yan, hindi niya mapapatay ang virus kapag nasa body na siya. Okay? So, ayan, pag summer din. So, heat will not actually, there's no direct link in killing the virus by high humidity or high temperature. Okay? Sunbathing will not cure COVID-19. Okay, so I think that's the end of my presentation. So again, we have to take care of our COVID-19 patients, but there are also other patients aside from COVID-19. So we have to take care of ourselves to prevent the spread or the chain, to break the chain of transmission. And I've emphasized the minimum public health measure nga, paulit-ulit, but to date, sa ngayon kasi ito pa lang ang mapanghahawakan natin eh. So hand washing, proper wearing of masks and PPE, maintenance of physical distancing, and if we have this capability to have these adjunctive strategies like HEPA filter and ultraviolet irradiation, we can use this. And also, I've emphasized a while ago the importance of environmental disinfection. So yan, physical distancing. So might be difficult for us Filipinos because we are very clingy, di ba? So gusto beso-beso. But now we have to adapt to this new normal, new way of greeting daw. So pwede namang wave lang or nod or pwedeng bow, no? Parang sa Japan, to maintain lang physical distancing and to lessen the risk of getting the virus. So wear the mask all the time because studies show that if you have the infected person here and you're the susceptible host and both of you are wearing the mask, you decrease or you lessen the transmission probability. And again, yan, paulit-ulit si Dr. Eva, but we have to perform hand hygiene all the time. Kung meron pang hindi nakukulitan, diba, sa hand hygiene, So dapat ngayon, makulitan kayo. So perform hand hygiene all the time. So this summarizes all the basic protection strategies. I think I've discussed all our objectives. So I just want to share these lessons. So we are still, the battle is not yet finished. We are continuously battling with the pandemic, but we have all of these lessons that from COVID-19 that we can continue. So life is short, jobs are temporary, health is wealth, always save money, but we need God to survive. Okay, so this is taken in a hospital wherein I'm wearing a level 4 PPE because I'm taking care of a confirmed COVID-19 patient. But when you're in the community, you don't need this PPE. And I just would like to offer this lecture to Dr. Algusman, who was my professor also, just like all of you, na naabutan si Sir Al. Okay, so I was once his student, and we all pray for the repose of the soul of our dear mentor, Dr. Algusman. Thank you.
Thank you very much po, Doc Eva. Ang dami po namin natutunan about sa topic nyo na prevention and management po ng COVID-19. So, ayun, proceed na po siguro tayo ngayon sa open forum po, no? Kasi sobrang dami pong mga questions na ating chat box po, no? Sisimulan po natin kay CMSC President Meg. Very interesting kasi ganito rin po talaga yung question ko ng maraming tao na, good afternoon, Doc. What can you say po about the government na seemingly nakaabang na lang sa development ng vaccine? Have we reached the point po ba na vaccine na lang ang sagot?
Sige. So siguro hindi naman ganun ang only thinking. I think that's not fair enough din naman for the government for us to say that. But agree with all of you na vaccine is not the, kasi minsan yun ang nagigiano na lang, no? It's not, that's why we have this lay forum okay, or this webinar to educate everyone that vaccine is not the only solution for COVID-19 or for ending this pandemic. So there are a lot of ways wherein kung sama-sama lahat tayo, we can somehow end this vaccine. So there are ongoing trials on the appropriate medicine, so solidarity trial on the recommended medicine against COVID-19. That's an ongoing study. Philippines is one of the participating countries to that. So aside from vaccine trials na hindi pa nga nagsisimula sa ngayon, okay? And again, if we only just cooperate, okay? So I understand yung difficulty din ng government side, okay? So the least that we can do is to cooperate with their recommendations because they cannot do this alone. Okay? So nakita na natin yan So we are in a pandemic and all of us should contribute, okay, to the best that we can, how small it might be. So we have to contribute, we have to give our own share of our contribution to fight, to battle or to fight against this COVID-19. So vaccines definitely will help, okay, just like for any other disease, but it's not a 100% protection. Okay? So dapat hindi lang lang yung ultimate goal natin. Diba? So that can be one of the parameters or measures that can somehow give us hope to end this pandemic. So there are other projects by the government. I just want to emphasize, I think contact tracing is one of the biggest important project or activity of the government. Because if we do thorough contact tracing, nakita yan sa ibang countries, when they perform very good contact tracing, makokontrol kasi yung spread of the virus. Nasagot ko ba yung tanong ni Meg?
Opo, Doc. Ayun po, may other question kasi speaking of vaccine din, connect ako na po dito sa ating second question. Good day, Doc Evelyn. Supposing that a vaccine and cure becomes discovered and made, do you think that COVID-19 will be gone for good or will we live with it for the rest of our lives?
Medyo difficult question. So thank you. Oo. It's really very difficult to predict. Okay? Pero what can I just say is that vaccine, again, yun nga, it's not 100% protective. Until when? Okay, magtatapos ba si COVID ngayon? Or we'll live with it for the rest of our life? We don't know. Only God knows. So hindi talaga, I cannot answer that at this point in time. But what we can do now is that we just continuously study and understand what is the present data or present information. And again nga, vaccine should not be the be-all or end-all of everything, because even if we have that COVID-19 vaccine already and it was found out to be really effective, it's not 100% protective naman. So who knows? Baka magkaroon pa rin after 10 years, we don't know. Hindi natin masasabi.
Thank you po, Doc. So another question from Miss Cristel Ayana from the CMSC. Good afternoon, Doc Eva. Since you mentioned po the symptom-based criteria for discharging, once the patient is discharged, ano po yung suggestions nyo for the patient once discharged, since he or she will be back to the community? Wouldn't there be a risk for him or her to shed the virus kasi wala nga pong repeat RT-PCR? Ayun po.
So, good question, because she gave me another opportunity to really emphasize that now we advocate the symptom-based approach already for managing or for lifting the isolation precautions. So again, medyo difficult for the people to accept this kasi nasanay eh. Yun nga nasabi kanina ni Sir, our second lecturer, na mahirap yung peace of mind, no, when you still think na positive pa rin yung RT-PCR mo. But studies showed kasi, so evidence-based naman yun eh, na as long as you are not symptomatic anymore and you observe yung minimum time, okay, of isolation, so 14 days and then 21 days for critical, somehow you'll be categorized as recovered or not infectious anymore. Okay? Pero hindi dinidiscount ngayon yung wala pang specific study talaga that once you had COVID, you'll be immune for life. So hindi kasi. So although hindi pa fully established that the infection can occur, pero wala pa ring statement that once you had COVID, you'll be immune for life. Okay? So yun ang medyo ngayon, medyo objective. Okay? So during this time, so yan, siguro continuous lang, remind people that based on studies, so we have this responsibility to inform people that based on these studies, even if you have an RT-PCR positive, because that can just be a remnant only of the virus and not necessarily indicating that we're still infectious, you can go back to the community. Okay? So yun nga parating tanong, hindi ba dangerous? But napag-aralan naman yan eh. So that's evidence-based already, and that's the most practical and rational decision coming from the Department of Health.
Thank you, Doc. So another question. Okay pa po ba mag-entertain ng questions?
Okay.
Siguro mga last two po. So, from Miss Angelica Kiamco, Doc, ask ko lang po yung sa new guidelines about sa lifting ng quarantine of an asymptomatic and mild person. Do you agree with the offline recovery of the DOH, knowing that there are data saying that some of the labeled recovered mild and asymptomatic still dies? And if some did die, is it possible that the virus is still active? Thus, it is also possible that the recovered person can infect other people? Ayun lang po.
Sige. I cannot comment dun sa DOH data kasi I really don't know, maybe si Carlo or ano, I really don't have their actual information. Pero yun nga, I don't know with the data gathering, but yung second question niya na ano nga yung once you're recovered, you can still get it, diba? Yun ba yung tanong? Tama?
Ito po. And if some did die, is it possible that the virus is still active? Thus, it is also possible that the recovered person can infect other people.
You know, the course of the disease is not that, any disease naman so it's not that, diba yung sinasabi natin, hindi lahat yan, dekahon, na ito lang. So life is very dynamic. So this is, we're talking about human lives already. And we really don't know, there are other causes of mortality that will it be directly related to the COVID-19, or there might be other circumstances surrounding his or her demise. So it's very difficult. And as I've said, kanina sinabi ko na it's not yet established that we have reinfection, but there are some reports already that a patient was tagged as recovered but eventually died. So siguro yan ang one of the research gaps in terms of COVID-19. So it might require further studies to really support that information about reinfection of getting COVID-19. But I think so far, ang masasabi ko lang is that so far ang ini-establish nila is that once you had COVID-19, there is a probability or possibility that you can get it. So there's no lifelong immunity. To date, sa ngayon, yun ang nakikita nila. There's no yet lifelong immunity with COVID-19. Kasi meron nagka-COVID na nung March and then eventually positive pa rin sila. So ibig sabihin, it doesn't confer lifelong immunity.
Okay po, Doc. Thank you. Last two questions. So, from Joey Farinas, good afternoon po, Doc. Is it advisable or okay to use, wear fabric/cloth mask na nilalagyan ng tissue sa loob kapag lalabas or alternative for medical masks?
Sige. In the community, di ba, yung mask na nire-recommend, it's not necessary naman yung face mask. So sa healthcare setting yun. So in the community, cloth mask is actually approved or advisable to be used. Pero yun, tama. Yun kasi ang difference ni cloth mask at saka ni face mask. So si face mask, meron siyang parang water repellent or water resistant na characteristic or feature. As compared to yung cloth mask, tela yan So, madali siyang mabasa. Siguro that's the reason why they are putting tissue. Okay? Pero it's not really recommended. So, in the community, if you wear cloth mask and somehow pag nabasa na siguro yan, maybe that's an indication, that's an indication that you have to change it, okay, with a new cloth face mask. Cloth mask. So, hindi siya nire-recommend that you put tissue sa cloth mask pa. So again, very important that you follow the proper way of wearing mask and also proper cleaning. Kasi itong mga cloth mask na to pwede namang labahan.
Thank you po, Doc. So, another one from Miss Maria Angelica Luna. Thank you, Doc Evelyn, for the very informative presentation. Is it advisable to never take off your mask if you are outside or in a public place because there are instances when you might need to drink water, eat food, wipe your sweat, etc.? What should be the proper action taken? And is there a suggested usable period of using face masks?
So that's a very practical and valid question. Totoo naman. Diba, with this pandemic, we were limited sa maraming bagay. Hindi ka na makakain, makainom anytime. But there are instances wherein you really have to take down your mask kasi kailangan mong kumain. Hindi naman po pwedeng hindi kumain ng how many hours. So, regarding your question, so yes, it's allowed even if you're in the community to remove mask while you eat or you drink. But what is the recommendation is that meron siyang specific recommendation eh. Whenever, for example, you remove the mask, you don't touch the front part of the mask because we consider the outside part of the mask as contaminated already. So you never touch that front part of the mask. You remove your mask using the sling, di ba? And the recommendation is, while you are not using it, lagay niyo muna sa paper bag or envelope, paper envelope while you are eating. Nakikita ko minsan sa mga restaurants, di ba? Open na ngayon ang mga restaurants, nakapatong lang sa table si mask. So that should not be done. So whenever you eat, you remove your mask, you perform hand hygiene, you put it sa, ayan nga, envelope or paper bag. They don't recommend plastic eh, kasi nagmo-moist daw with plastic. So paper ang nire-recommend nila, and then you put it, you perform hand hygiene. Kung tapos ka nang kumain, then you get it from the paper bag, ilagay mo ulit yung mask, and you perform hand hygiene. Ideally, yung paper bag which pinaglagyan mo ng mask should be thrown away sa trash. Tapon na.
Ayun, thank you po, Doc. So before we formally close this open forum, last pahabol na po kasi naging controversial po itong sa news po ito. Yung tuob po ba ay effective talaga for COVID?
I think meron ng infographics ang WHO and DOH with that. So steam kasi yun eh. So it's not a scientific or an effective way really of preventing COVID-19. So maybe in other, it can dilate kasi yung bronchioles, maybe in inhalation, but not directly with COVID-19. So again, I just want to emphasize here, para hindi tayo malito with all of this fake news, we have to have a good background on how it is transmitted. Kasi kung alam natin how the virus is transmitted, so human to human or direct, then we can discount all of these myths, say, or fake news in how to prevent the virus. So nung una, medyo first 2 months, medyo allowable pang pagka-running ng mga tao kasi bago eh. But as the time goes by, okay, we are on the 6th month of the pandemic already, and we gain a lot of information also, scientific or evidence-based. So dapat our decision, our reaction should also be rational already, or scientific